I'm washing my hands. Hi, my name is Courtney. I'm going to be your nurse for today. Can you please state your name and date of birth?
Christine Schultz, 11070.
Okay, thank you. Do you have any allergies? And if so, what is the reaction?
No known allergies.
No allergies? Okay. So currently what I'm going to do is assess the patient's posture. I'm just assessing their general status right now. I'm assessing their posture, their breathing, if they're breathing with any accessory muscles, their distress, and their hygiene. So they are perfectly dressed for the weather. They have a good hygiene. They're sitting up straight, or they're sitting with a straight back in an upright position. And there is no signs of distress. And then they're not using any accessory muscles to breathe. So next I am going to assess the heart rate and the respirations. So can I please see your hand? Just gonna check the radial pulse. So what I'm gonna do is I'm going to count the pulse for 30 seconds if it is regular. If it is irregular, I'm gonna count for 1 minute. I'm also going to be grading the pulse afterwards. So the pulse is regular, so I'm gonna count for 30 seconds beginning now. Give me 1 second, okay. Beginning now. So the heart rate was 75 beats per minute, and then the respiratory rate was 14 breaths per minute. The pulse was also regular, and I am giving it a 2+ grading. So next I am going to assess your orientation. I am going to assess the patient's orientation for time, place, person, and situation. So can I please have you state your name and date of birth?
Christine Schultz, 11070.
Okay, and then can you tell me the date?
11/23/20.
Okay, and then can you tell me where you are?
Just at the doctor's office for a routine checkup.
And then you're here for the checkup? Okay. So the patient is alert and oriented ×4. So next what I'm going to have the patient do is lie down. And then if I could just have you lift up your shirt just right under your breasts. Go ahead and lay down for me. So right now I'm going to inspect the shape of the abdomen. I'm also going to check for symmetry. So the abdomen is slightly rounded. And then the abdomen is symmetrical. So I am next going to just observe the skin. I am not seeing any abnormal scarring. I'm just seeing a little bit of striae, and the skin is pale. I'm not seeing any lesions or hernias. And then next what I'm going to do is auscultate the quadrants of the abdomen. I am going to listen for bowel sounds. So I'm going to begin at the right lower quadrant. So there were bowel sounds in all 4 quadrants. Next, what I am going to do is I am going to percuss the abdomen. I'm going to just hit the tops of my fingers. I'm going to begin again in the right lower quadrant. So what I am hearing is tympany over the majority of the abdomen, but once I get over the liver, I am hearing dullness. So next what I am going to do is I am going to lightly palpate the abdomen. Do you have any pain in any areas right now?
No.
Okay, so I just want you to tell me if anything hurts while I'm doing this, okay? Just try and relax your stomach if you can. So again, nothing was painful?
No.
Okay, so there was no pain on light palpation. Next, I am going to do deep palpation. I'm going to be feeling for the structures of the abdomen, and I'm going to be feeling for any masses or abnormal structures. So I'm going to go ahead and begin, and then make sure you tell me if anything hurts too bad. I know this isn't going to be the most comfortable, but if anything is very painful, please let me know. Okay, any pain?
No.
So I did not feel any masses, and then the patient did not report any pain upon deep palpation. So next, what I'm going to have the patient do is sit up for me, and I'm going to be assessing the abdominal tone. So the tone is normal to strong. They did not need any help getting up. Next, what I'm going to have you do is just turn a little bit to the side for me. I am going to be assessing CVA tenderness. I'm just going to hit your back with I'm going to place my hand on your back, and I'm going to hit my hand with my fist. I just want you to tell me if anything hurts when I do this. I know it might startle you a bit, but if anything hurts too bad. Did you feel any pain?
Mm-mm.
Okay, so there was no CVA pain bilaterally, and that means the kidney probably does not have any issues as based on that test. So you can go ahead and turn back around to me. So do you have any questions?
No, none at all.
Okay, sounds good. So then the assessment is finished. Thank you.
Thank you.